And good afternoon. It is time for our regular Lunch and Learn, and it is the last Lunch and Learn for 2023. So next week our office is closed, and so I'm going to be enjoying my family and the last of 2023. And so we will not have a new Lunch and Learn until 2024. So today we're going to be talking about cholesterol and cholesterol medicines. Now, Western thinking is that if you have high cholesterol, then you're going to get heart disease. And so this is a myth that I'm going to show you with some studies, how they interpret the studies, how they do the risk-benefit analysis and that kind of thing. So I'm going to geek out on you just a little bit. But if you saw the announcement for this post, there were some infographics that went along with this article that I put in the post. So you can look at that and you can see that we're not necessarily being told the whole truth. And so cholesterol is a molecule that your liver makes. And the LDL, which is the so-called bad cholesterol, is really your body's way of making a Band-Aid for inflamed tissue so that you don't have a blowout, okay? So just because you have high cholesterol does not mean that you're going to have a heart attack. What it means is that you have some inflammatory processes going on, and if you artificially reduce that cholesterol, then you're going to have other issues. You're not dealing with what is causing the inflammation. And every sickness, every disease, especially chronic disease and autoimmune disease, is a result of chronic inflammation. So cholesterol is a marker that tells us we've got inflammatory processes going on in the body. So what makes inflammatory processes? It can be the food we eat, the clothes we wear, the drama in our life, the water we drink, the sodas we drink. All those kind of things cause inflammatory processes. And so what we want to do is look at what is behind the statin drugs, because we want to make sure that we're doing what we need to be doing, all right? And so statins are one of the highest selling drugs in the United States. It is one of the best sellers. It is the most commonly prescribed type of drugs out there. The first cholesterol drug, quote unquote, was produced by a Japanese biochemist, and he discovered how to make statins from mold. So his research caught the attention of Merck, the pharmaceutical company. They took that research and they developed their own drugs for cholesterol. I think the first one that they did was Lipitor. I think we're going to be reading about that in the article. In 1987, it's lovastatin. So Lipitor is a brand name, but it was lovastatin is what was the first commercial statin in the United States. So statins are regarded as life-saving medications because they tell you that they reduce the risk of heart attacks and strokes. But what we're going to see in the report is that is not necessarily true. And so if you've been prescribed statins, or if your doctor has wanted you to get on statins, there's going to be some research that you're going to want to look at, because there are so many side effects that go along with these drugs. And so the drug manufacturers are not necessarily wanting you to know about these side effects, and so they're not majoring on the side effects. And so if you're not doing your due diligence, then you could be suffering from other things that you don't need to suffer from just because you do not know. All right. So the doctor, this is Dr. Malcolm Kendrick, and he is a UK-based physician who has published multiple reviews on cardiovascular disease and statins in academic journals. And he says that the researchers are hyping the results. And this is what he says. Suppose there are two groups of 100 people. The first group is taking an experimental pill theorized to prevent heart attacks, and the second group is taking a placebo. During the trial time of 2 years, the first group experienced only one heart attack, while the second group recorded 2. Statistically, the experimental pill appears to be insignificant in its cardiovascular protection. You take the cardiovascular protection drug, only one person in the group gets it. And the group that has a placebo, only 2 people, have an issue. So that's not a significant reduction in the risk. However, when they do a relative risk model, it shows that the pill stops 50% of cardiovascular diseases. And so when they tell you that in the risk reduction model, they hype the results. So in the raw data, 1 and 2, well, yes, we know that 2 is 1 more than 1, right? But that's not 1 and then 50 or 1 and then 100, right? So it doesn't really reduce it all that much. And that's what he's saying. Statistically, the experimental pill appears to be insignificant in its cardiovascular protection. But when the relative risk reduction is applied, it shows a 50% efficacy. The inflation in the data spurred glowing reviews in the media. Reporting the results of a large 2008 study, the New York Times noted that the risk of heart attack was more than cut in half by statins. Now, this particular study evaluated AstraZeneca's Crestor on 17,802 people without high cholesterol, finding about a 50% relative risk reduction in the heart attack in the statin group. What that really means, though, was a 1 to 2. All right, and so that's what you need to know. Another study commonly cited to exemplify statins' robust protective effects was a long-term trial involving Pfizer's drug Lipitor. The absolute risk reduction on both of those studies was approximately 1%. So, in real terms, if you take a statin drug, you're going to reduce your risk of getting cardiovascular disease by 1%. 1% is not statistically significant. It's just not. 1% is hardly anything, really, hardly anything. So, in a 2022 study, investigative report published by JAMA Internal Medicine, the researchers from different countries reviewed 21 clinical studies on statins. They averaged in a relative risk factor reduction on all causes of mortality by 9%, and for heart attacks, 29%. However, the absolute risk reduction was 0.8% and 1.3% respectively. The researchers noted that the absolute benefits of statins were modest and should be communicated to patients as part of informed clinical consent decision making. So there is a big, big difference in the risk reduction, relative risk reduction. That is a way of hyping the statistic when you're looking at the absolute benefit, okay? So who's behind all of these studies that tell us that statin drugs are good for us? Well, this is a question that Dr. John Abramson, who is lecturer emeritus of the healthcare policy at Harvard Medical School. He says virtually all major clinical trials of statins are funded by the manufacturers while the drug was still on patent. So what does this mean? This means if you're funding the study, you're making the drug and you're doing the study, you're going to skew the results to have the outcome that you want it to have. It's not independent researchers. It's not independent manufacturers. It's not independent clinicians. These are studies that are designed by the manufacturers to have the results they want you to have, okay? In a 2015 investigative meta-analysis published by the Journal of American Cardiology, researchers reviewed all phase 2, phase 3 clinical studies in a decade. They found that nearly 80% of the trials had a conflict of interest, and almost 60% involved more than half of the authors. So of these studies, 54 had favorable outcomes and only 12 had unfavorable results. So what does that mean, conflict of interest? So let's just say that I have a chiropractor friend, which I do, and I refer people to him all the time. Why? Because he's helped me with some of my back issues, and I think that he's a very honorable person, and I don't think he's going to hurt my people, right? And so I will, refer people to him. Now, do I get money for referring people to him? No, I don't. I don't get anything. I get a thank you, and I appreciate you, and that's all I get. That means there's no conflict of interest. I'm not getting paid. I'm not getting a cut. I'm not getting any of that. So it benefits me to recommend him. So what these studies are saying, that 80% of these studies that the doctors read and then they prescribe what they prescribe have a conflict of interest. So the financial ties allow the manufacturers to design the studies and select the patients most likely to benefit from and not be harmed by statin therapy. These financial ties also allow the manufacturers to not compare the benefits of statin therapy to the benefit of adopting healthy lifestyle habits, and they do not ask prospectively about side effects, Dr. Abrams said. The peer-reviewed study of the medical journals who viewed these papers, quote, do not have access to the actual data of the trials and must trust the usually manufacturer supervised or reviewed manuscripts as an accurate and complete summary of the trial results. So what does that mean? If I were a scientist and I was going to do a test on this particular drug, I should give you all my information, give you all my raw data, give you my hypothesis, give you my results, and then you look at that and you analyze that. Was I being truthful or was I not being truthful, right? That's not what's going on here. They're getting the manufacturers, the financial people, they're getting their interpretation of the data, and the manufacturers are interpreting the data the way they want the data to be interpreted because they have an outcome that they want to sell more medications. That's what this is saying. So the peer review people do not have access for the raw data. So that's a big thing. In 2013, in conjunction with the American College of Cardiology, the American Heart Association adjusted its cholesterol guidelines, significantly broadening the criteria for determining which patient would benefit from the statin therapy. Previous guidelines targeted the prevention of coronary heart disease, whereas the 2013 guidelines expanded the focus to include strokes and peripheral artery disease. As a result, the number of individuals that were prescribed statin drugs increased by 149% from 2013 to 2019, reaching 92 million patients. That's a lot of patients. All right. Is there any indication that cholesterol drugs help stroke? Is there any indication that cholesterol drugs help coronary artery disease? Okay. Dr. Robert DeBuff, a cardiologist and retired professor at the University of New Mexico School of Medicine, reported major conflicts of interest among the framers of the cholesterol guidelines, including the 2013 guideline in the Quarterly Journal of Medicine. The guidelines authors also failed to include multiple studies that conflicted with their recommendations, which is evidence of confirmation bias. So what does that mean? That means I'm looking at 100 studies. 75 studies say cholesterol drugs do no good. I'm not going to talk about those. I'm going to talk about the 20 studies that show that cholesterol drugs do what they're supposed to. And so that is confirmation bias. I'm only going to look at the research that supports my hypothesis, what I think, what I feel is true. I'm only looking at that. And so they found, this doctor found that they had quite a high percentage of conflict of interest there and confirmation bias because they did not look at things that were against their own point of view. Doctors seeking to prevent coronary heart disease by lowering cholesterol are confronted by a bewildering array of drugs, guidelines, indications, warnings, and contraindications. So I want to kind of talk about contraindications, because what that means is if I have high cholesterol, if my doctor thinks that I have issues with cholesterol and it can cause me to have heart disease, then he's going to prescribe that medication. But what is that medication going to do, and what other conditions do I have that might be contraindicated? All right. So the doctors expect these opinions, the ones that they read, the one that they look at, to be comprehensive, balanced, unbiased, and unsullied by financial contracts or financial conflicts. Unfortunately, these examples illustrate that some expert opinions fall short of these standards. The AHA accepts millions of dollars, this is a quote, millions of dollars from big pharma, big food, and medical device companies, says Dr. Barbara Roberts, who is the director of the Women's Cardiac Center at the Miriam Hospital in Providence, Rhode Island. She's an associate clinical professor of medicine at the Alpert Medical School at Brown University. In 2022, the American Heart Association received nearly $34 million from pharmaceutical companies, including multiple statin manufacturers, according to its 2021-22 report. Now, what does that mean? That means if I'm a medical school and I'm getting a lot of money from these pharmaceutical companies, I'm not going to, cut off the hand that feeds me by saying that these drugs are not working, or saying that there might be a better way, or saying that you can make diet changes, or saying that you can have lifestyle changes and have the exact benefit that you want to prevent cardiovascular disease. So those are the things that they're finding, is that these schools, these medical schools, are being funded by the pharmaceutical companies, and so they're saying what the pharmaceutical companies want them to say, because that's where they're getting their money. The majority of the writing committee experts, right, have no relationship with the industry. That's what they're telling you. Another industry-funded meta-analysis of 19 statin trials with declared conflicts of interest found that statins only, quote, rarely cause substantial muscle damage. Now, that's one of the things in the reports. If you look at truly non-biased reports, they're going to tell you that statin drugs cause muscle damage, actually cause heart damage, cause cognitive decline. And so this is why statins should be used under, advisement when you know what the side effects are, because you don't want to be putting something in your body that's going to be causing some different problems. So we've got several independent studies that show significant differences. The most common and noticeable side effect are muscle-related problems, with one report noting that 51% of statin users experience muscle pain, while a 2022 study shows that between 70 and 80% of statin users experience muscle pain. It says many doctors are familiar with patients complaining of muscle pain, but they just put it down to being older, to being an age-related complaint, or to be made just all in your head. And so they're not really putting two and two together there. Some reports also indicate that statins could impair cognition, which has led the FDA to add additional warnings. In one study published by the American Journal of Geriatric Pharmacology, researchers tested the cognitive function of older adults with Alzheimer's disease who were also using statin medication. Now, I found this to be very troubling, okay? So if you are older, I am older. Thank God I don't have any cognitive deficits that I know, all right? However, that's one of the things as we get older that we have a challenge with. So when they tested the cognitive function of older adults with Alzheimer's disease who are also taking statin medications, the patients stopped taking the statins for 6 weeks, and their cognitive function significantly improved. After they resumed taking the statin drug, their cognitive reasoning digressed back to the original state. And so this is something that I find very, very troubling, that people will take cholesterol drugs, then they're dealing with the mental issues, and then when they take them off the cholesterol drugs for a few short weeks, 6 weeks, they find that their cognitive difficulties they're resolved. And so when they put them back on, they go back to the way they were before. So this is clear evidence that these statin drugs cause this cognitive impairment. A separate study found that among patients with early mild cognitive impairment, statin use was associated with more than a 2-fold risk of converting to dementia with, quote, highly significant decline in metabolism of the posterior cingulate cortex, the region of the brain known to be the one that most declines with cognitive situations in Alzheimer's disease. So this is really, really important. There is a 2-fold increase in getting the risk of Alzheimer's. All right, this is something that's really, really important if this is you. If this is you, somebody you love, somebody you know. Another issue related to statin users is insulin sensitivity. So when we become insulin resistant, what happens? We are a prime candidate for diabetes. So in a recent systematic review of 11 epidemiological studies with nearly 47 million participants, found associations between statin use and decreased insulin sensitivity, increased insulin resistance, both key factors to developing type 2 diabetes. Researchers found that increased diabetes risk was associated with long-term use. All right, the observations were not ascertained in the industry-funded trials, given that many were cut short, Dr. Roberts points out. All right, so they don't want to hear that, so they cut the study short, and they didn't report on that, according to what this doctor is saying. So statins dominance originated from the concept that high cholesterol is the leading cause of heart disease. The battle against cholesterol started in 1950 with a scientist named Ansel Keys. He hypothesized that dietary fat, saturated fat, elevated LDL cholesterol, which, according to his framework, was the root of the country's cardiovascular health crisis. This concept is the famous, quote, diet heart hypothesis, end quote. Keys launched the 7-country study, an influential nutritional study, according to Johnny Bowden, who is a researcher and author with a doctorate in holistic nutrition. The study analyzed the dietary habits of 12,763 men aged 40 to 59 from 7 different countries, and found that societies that ate less dietary saturated fat were less likely to suffer from heart attack, while those who had a higher intake of saturated fat had a stark risk increase. However, these findings have been highly contentious among nutritional scientists, with many highlighting incongruent data, bias in the country selection, and a cursory observational period. So what does that mean? That means incongruent. It's not the same across the countries. Bias in country selection, we're going to select these countries, but we're not going to select these countries. And then cursory observational period, just how long did they study this? Was it long enough to really get a clear idea? All right. The findings became like the standard of what we in the West, what we think about. Remember back in the, 70s, 80s, people were saying don't eat eggs because eggs raised your cholesterol. Well, that has been debunked. And so there are a lot of these things that have been debunked. One of the errors in the 7-country study was that it excluded countries such as Germany and France, where saturated fat consumption is very high, and yet heart attacks are very, very low. Another error that was first exposed by investigative journalist Nina Teicholz, I hope I said her name right, was that Keys sampled dietary data from only 3.9% of the study's participants, fewer than 500 out of almost 13,000 people. So that's a very, very low sample. It's not even a 50%. I think they said it's a 3%, 3.9%, not even 50%. So how are you going to make a policy that diet is the driver of high cholesterol if you're only doing a study with 3%, 3.9%, 4%, we'll say 4%, okay? So Key's dietary observations of the Greek Orthodox Cretan population was skewed, given that one of his periods of observation took place during Lent. The dietary guidelines of Lent prohibit meat and dairy, which are foods high in saturated fat. So this is another problem with this particular hypothesis, is that they studied people who weren't eating any of this. And so how can you tell if this is bad if you're studying people that aren't doing it? So this particular investigative reporter sent a letter to the editor, and it was published in the Public Health Nutrition. And so that's one of the things, people are trying to bring all these conflicts to light, but nobody has the money that Big Pharma has. Nobody has the money that the big food companies have. And so they're just not able to get that prevalent opinion. Fact checkers, again, it's just what we see all the time. There was a tremendous bias from the start. Keyes had something to prove rather than a hypothesis to test, says Mr. Bowen. So the heart diet hypothesis became the prevailing theory to shape the U.S. dietary guidelines, which dictate the food served in schools, military, and hospital cafeterias. The guidelines also play a significant role in the advisory committee members of the 2020 to 2015 dietary guidelines. They were found to have conflicting interests with the food and pharmaceutical industry, according to a report published by Public Health Nutrition. So what does that mean? That means there's conflict of interest. So can you trust the findings of a committee that has conflict of interest? One surprising study was done in 2017 that revealed that people who consumed coconut oil, which is 94% saturated fat, they saw a decrease in LDL cholesterol levels, whereas people who consumed butter, which only had 66% saturated fat, saw an increase. So this is a study that points out problems with these guidelines, because clearly coconut oil, I think it's a good oil. We recommend it. It has shown great promise with people that have dementia and Alzheimer's and that kind of thing. And yet it is 94% saturated fat, which nobody should have according to these guidelines. So the LDL cholesterol level is seen as a key cardiovascular biomarker, and some believe that the higher levels indicate higher rates of disease and mortality. However, in a meta-analysis including 19 studies published in the British Medical Journal, researchers found that people with higher LDL live longer than people with low to normal LDL. So this is what I wanted to bring to you today, because we have people come in all the time with their blood work, and their doctor is saying you need to be on cholesterol medicine or your cholesterol is too high. And so they come in and they're very scared, because it's been drilled into our psyche that if we have high cholesterol, we're going to have problems with our heart. What the research is actually showing is that that is not necessarily true. High cholesterol, high LDL is an indicator of inflammation. So cholesterol is a real big 28 atom molecule. From that cholesterol molecule, all of your hormones are cleaved. So your thyroid hormone, your sex hormones, your antidiuretic hormones, all the different hormones you have, and we have a gazillion hormones, okay? It's all cleaved. They're all cleaved from cholesterol. Every cell in your body has a cell membrane. That cell membrane is made of cholesterol. Your brain runs on cholesterol. So if your cholesterol level, your overall cholesterol level is low, you're not going to have enough cholesterol to go around. And that last study that I talked to you about showed that people with high cholesterol live longer than people with low cholesterol. So we don't want your cholesterol to be high. I'm not saying it's okay for your cholesterol to be high. We don't want that. Why? Because high cholesterol tells me there's inflammatory processes going on in your body. I know, you know, that if you have a lot of inflammation that is not resolved, you're going to move into a chronic disease pattern, maybe an autoimmune pattern, and we don't want that. So we're not saying high cholesterol is fine. We're not saying that. What we're saying is we don't want to lower that cholesterol to a abnormally low number, because then you're not going to have enough to go around. If you are a man, if you have a low cholesterol number, you're not going to have enough cholesterol to make testosterone. You're not going to be getting erections, and that's a big thing. All right. If you're a woman, you're not going to have enough cholesterol to go around to have estrogen. Estrogen is cardioprotective. That's a big thing. So what are the guidelines? We want your overall cholesterol to be around 200. We don't want it to be under 150. We don't want it to be close to 100. I know your medical doctors are going to say that. I get that. I've seen the reports. I'm saying from a holistic point of view, we want your body to function the way your body needs to function. Your body makes more cholesterol if you have inflammatory conditions. So what we want to do, remove the inflammation, pathogens, bacteria, viruses, parasites, fungus, right? Remove all those, your inflammation is going to come down, the body's not going to make cholesterol. Does that make sense to you? So we don't want to take a medication to artificially lower our cholesterol while we leave the inflammatory markers not doing anything about those, because what that's going to do is going to drive chronic disease. So I'm hopeful that I did not sound like Charlie Brown's teacher. I'm hopeful that you were able to see that there is quite a lot of conflict of interest with these studies. There's a lot of financial backing to get these studies to say what the manufacturers want them to say, because they want to drive sales of their medication. Do I want you to have high cholesterol? No, I do not. There is a reason that you have high cholesterol, and it's not because you have a shortage of statin in your diet. You have high cholesterol because you have uncontrolled inflammation. So we want to get to the inflammatory process so that we can get to the place that we need to be so that your cholesterol stays within normal levels, so that you've got enough to go around for your cells, you've got enough to go around for your hormones, and you've got enough to go around for your brain function. So those are the takeaways that I want you to have today. If it was confusing, pop it in the comments and I'll try to clarify. Thank you for watching. Thank you for honoring me with your time. I always respect that. I've gone a few minutes over and I apologize for that. Again, this is the last Lunch and Learn for the year, and I will see you in 2024. Be good to yourself. Have a very Merry Christmas and a wonderful New Year celebration, and I will see you in 2024.